Honorable Chairperson, respected panelists and learned audience, very good afternoon to all and welcome to everybody on today's exciting session. I'm Dr. Chyan Singha. Today I will share some experience to you that my title is A Little Neglect May Breed Great Mischief. You know, this great singer recently passed away from our beautiful world due to just negligence of his cardiac symptom. So any source of patient should not neglect particularly ischemic chest pain because any danger thing can happen. My first case, a 40 years old gentleman who was driver, known case of hypothyroid, generalized obesity and NASH. When he attended to our hospital, his partner first addressed that he had extreme snoring with frequent cessation of breath at night. The patient complained about undue fatigability, unfresh sleep at night and excessive daytime sleepiness. Obviously, through polysomnography, we diagnosed him as a case of obstructive sleep apnea, and according to the respiratory physician, we put him or advised him for CPAP. But he was reluctant regarding his treatment, and he did not receive the treatment, rather he was rushed to go to abroad. And within a couple of months, while visiting a hospital to see his elder brother, he developed severe chest pain followed by cardiac arrest. He was so fortunate that he was reverted back, and his immediate ECG showed a still elevated MI anterior, where he was managed conservatively and later returned to home. As he had chest pain of CSS class 3 despite of optimal medical treatment, so he underwent coronary angiogram. And this is the angiographic picture. Here shows the left main normal, L6 was big, and LED is totally occluded from its proximal part. And this is the spider view showing the totally occluded LED from its ostial part. And in the right system showed the non-dominant tarsier. So this is a case of single vessel coronary artery disease, and our plan to open up the occluded LED. Accordingly, we took EVO 6 guide catheter through which we tried to negotiate field direct wire. Here shows that wire is kinking, so we took balloon through balloon assisted tracking. Ultimately, we were able to cross the negotiate the lesion, and then we took the different size of balloon, sequential pre-dilatation was done, and then suitable landing zone was detected. And for more extra precaution, we take the another wire, placed into the OM, and then we took a 3 into 24 millimeter diagulating stent synergy, and we deployed, and ultimately post-dilatation was done, and this showed the wonderful result. After this event, patient was motivated and he was on CPAP along with other necessary medication, and he is feeling of a great sense of well-being. You know, this is the legend singer who also suffered from the obstructive sleep apnea, and lots of our population in our community actually suffered this source of obstructive sleep apnea, which is under-addressed in our country, so we have to keep in mind this. Our second case, a 36-year-old female who was known case of hepatocellular carcinoma with status portosystemic shunt for excessive varicose bleeding. Her physician planned to ensure total parenteral nutrition due to excessive malignancy induced nutrition and nutritional deficiency. According to the right subclavian venous catheterization plan, and this is the instrument you know, and during the second step, actually unintentionally and inattentively, the primary physician just pushed the J-tip short guide wire, and then J-tip short guide was completely introduced into the vessels, then procedure was stopped, and the patient feel excessive palpitation. This is the ECG was done. Immediate portable chest X-ray was carried out, which revealed the wire was dislodged into the vessels and heart. Then she was referred into our hospital. We take the patient promptly into our cath lab, and through the retrievable system, we gently retrieve this dislodged wire, and finally we retrieve this J-tip guide wire. So there is a rule of thumb that we should not manipulate roughly or inattentively. We have to be more cautious because it's a very simple procedure that is actually we carried out in the CC ward ICU in the frequently. So after the procedure, our primary physician, the patient, and we were extremely relaxed and share our experience. My third case is that a 36-year young adult having no coronary risk factor, he complained about a foot angina. So angiogram was done, and interestingly find that absence of LCX. And if during angiogram there is the absence of LCX, so we have to think about that whether it may arise from the separate ostia or from the right coronary sinus. So we select non-coronary, try to carried out this, but we didn't found in the left system. Then in the right system, there was a significant stenosis was detected in the distal RCA. So it's a very simple lesion. So we done angioplasty by taking the EBU 6-pin guide catheter where pedal was done, and finally 2.75 into 18 millimeter diagulating stent was done. Then as there was a mind that L6 may be found from the right coronary sinus, then just little pull of the catheter, we give the shot, and we found that there is a big LCX, and which was also diseased, and we ultimately PCI of that, and our patient is living well. So I am extremely grateful to my patient, my teacher, Professor S.M. Mustafa Jamal sir, Dr. Ryan Masum Mondul sir, and our expert cath lab technician, particularly Munna Bhai. And dear audience, my take home message is that any evidence-based treatment which is beneficial for well-being of our patient should be adopted very early. Cardiac symptoms are always notorious, so we should always respect this from very early. Any procedure, particularly invasive procedure, should be done with an extra precaution and more attentively, because any mishap can happen from its journey to end. And absence of LCX while doing angio should keep in mind that its anomalous origin. And ischemic chest pain, particularly in young patient, non-atherosclerotic coronary artery disease, especially anomalous coronary artery, should be kept in mind. So আমরা আসলে গভীর সমবেদনা জানাই যারা আসলে বন্যাতে অ্যাফেক্টেড। সাইমালটেনিয়াসলি আমাদের আসলে সামনে পদ্মা সেতু উদ্বোধন হবে, আমরা এটা লং একটা ড্রিম। So thank you very much for your patience here. Thank you.